Every day in healthcare, our action can either prevent infection or contribute to their spread. That is why infection prevention and control is a shared responsibility among healthcare workers. Good afternoon, everyone. I am Sarah, your infection control nurse supervisor, and today I will be presenting on behalf of the infection control team. Our team is under the office of the hospital director. Our head is Miss Claudette Ann Santa Ana, and Obrime Christine Arce, our disease surveillance coordinator. Here is the outline of today's presentation. We will cover the chain of infection, hand hygiene, needle stick and sharp injury, standard precaution, HIV/AIDS, and mother-to-child transmission of HIV. We will go through each topic in the next slide. What is infection prevention and control? Infection prevention and control, IPC, is a practical, evidence-based approach preventing patients and healthcare workers from being harmed by avoidable infections. IPC is unique in the field of patient safety and quality care, as it is universally relevant to every health worker and patient at every healthcare interaction. Infection and prevention control focus on hand hygiene, hospital-associated infections, injection safety, antimicrobial resistance, how hospital operate during and outside emergencies. So what is infection control? Infection control prevents or stops the spread of infection in healthcare settings. IPC is a scientific approach that aims to protect patients and healthcare workers from avoidable infections. Infection occurs when harmful microorganisms enter the body, multiply, and cause disease. Understanding the infection helps us why prevention is so important. Knowing what infection leads us to the next question. How do infections spread? That's where the chain of infection comes in. Breaking the chain. The term chain of infection refers to the condition links that must be met in order for an infectious disease to spread. The idea of breaking the chain of infection means stopping at least one of those links, thus preventing it from starting again. So our next question is, how do we break the chain of infection? So we have 6 links: pathogen, reservoir, portal of exit, mode of transmission, portal of entry, and also susceptible host. Our goal is to break the chain of infection by interrupting any of its links. For infectious agent or pathogen, how do we break it? Giving appropriate antibiotics, antiviral, or antifungal. And also for the nurses, giving the medication, right timing, and right dose. Proper sterilization and disinfection of equipment, and also early detection and treatment of infection. Second is reservoir, where the pathogen lives. How do we break the chain? Clean and disinfect patient care areas regularly. Proper waste disposal and linen management, maintaining hygiene of water, food, and environment, and also isolate infected patients when needed. Third is portal of exit. How pathogen leaves the body. How do we break it? By using mask for coughing and sneezing patient, proper covering of wounds, safe handling of body fluids like blood, urine, respiratory hygiene, and cough etiquette. Fourth is mode of transmission, how it spreads. The most important is the hand hygiene, use of PPE, gloves, mask, gown, proper use of gloves, mask, gown, please. Cleaning and disinfection of surfaces, equipment, safe injection practices, and avoid unnecessary contact and maintain distance when needed. Fifth is portal of entry, how pathogen enters the body. Always do aseptic technique during procedure, proper wound care dressing, use sterile equipment, avoid touching face, eyes, nose, mouth, and also always proper IV line and catheter care. Lastly is susceptible host. How can we break it? How can we break the chain? By vaccination and immunization, and also good nutrition and hydration, adequate rest and healthy lifestyle, and lastly, proper room placement for immunocompromised patient or neutropenic. We need to ask ourselves, are my hands helping prevent infection or spreading it? Because hands is the most common vehicle in transmitting pathogen. Always remember your hands can save lives or spread infection. Let's apply the WHO 5 moments of hand hygiene. So what are the 5 moments for hand hygiene? First is clean your hands to protect the patient against harmful germs carried on your hands. That's before going to the patient. Second is before the procedure. Clean your hands immediately before accessing a critical site with infectious risk for the patient. To protect the patient against harmful germs, including the patient own entering his or her body. Third is clean hands as soon as tasks involving exposure risk to body fluids has ended and after glove removal. It is to protect yourself and the healthcare environment from harmful germs. Fourth is after the procedure. Clean your hands when leaving the patient's side after touching a patient and his or her immediate surroundings to protect yourself and the healthcare environment from harmful germs. Lastly, fifth is after touching the patient's surrounding, clean your hands after touching any object or furniture in the patient's immediate surroundings when living without having touched the patient to protect yourself and the healthcare environment against germ spread.
What you need to know about hand washing. Why should I use soap and water to wash my hands? Germs can get on your hands and items you touch throughout the day. When your hands might be dirty, it's best to wash with soap and water to remove whatever germs and chemicals are on them. Warm or cold water. Either is fine, as long as it's clean. Bar soap or liquid. Either is fine. Does the soap have to be antibacterial to work? No. Plain soap and water work just as well. What if I don't have soap, but I have access to water? Using soap to wash hands is more effective than using water alone. But if water is all you have, rub your hands together under it and wipe off with a clean towel or air dry. When hands aren't visibly dirty, you can use an alcohol-based hand sanitizer that contains at least 60% alcohol. How long do I need to scrub when washing my hands? Scrubbing your hands for at least 20 seconds is most effective. Do I have to clean under my fingernails? Yes. Germs like to hide under fingernails. Make sure to clean there too. Towel or air dry. Either is fine, but if you're using a towel, make sure it's clean. Should I use a paper towel to turn off the faucet or open the door of a public bathroom? There isn't much scientific evidence about this. If you're concerned about getting germs on your hands after you wash them, you can use a paper towel to turn off the faucet or open door handles. What if I don't have soap or water to wash my hands? If soap and water aren't available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Alcohol-based hand sanitizers can quickly kill most types of germs on the hands, but may not kill certain bacteria and viruses that cause diarrhea. You should wash your hands before eating or after using the restroom. Protect yourself and others by washing your hands with soap and water. Learn more about the magic of hand washing. Visit cdc.gov/handwashing.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow-operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe. Please note that this technique is not appropriate when hands are visibly dirty or after using the toilet. In these cases, hand washing is required. Hand rubbing should take you 20 to 30 seconds. Use a timer or count 1, 2, 3, 4, 5 in each of the following steps. Apply a palmful of alcohol-based hand rub in a cupped hand, enough to cover all surfaces of the hands. Rub hands palm to palm, then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of your fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Once dry, your hands are now clean and safe.
So commonly missed areas during hand washing. Now that we've seen the correct hand washing technique, let's focus on the areas that are most commonly missed. The red area shows the most commonly missed parts are thumbs, fingertips, and between fingers. So let's emphasize cleaning these areas. So what happens when hand hygiene alone cannot stop the spread of infection? Even clean hands can't do it all. Standard precaution are the additional measures that keeps infection from spreading. So what is standard precaution? Using hand hygiene, of course. Use personal protective equipment, PPE, gloves, gown, mask, eye protection, face shields. Always remember, all admitted patients are under standard precautions unless diagnosed or suspected for transmission-based precautions. But I have another question again. So what if standard precaution is hindi kaya ng standard precaution? So, dun papasok yung transmission-based precaution. It is an extra layers of protection when standard isn't enough. For highly contagious or dangerous pathogen, we must use transmission-based precaution. So we have airborne precaution and droplet precaution. For airborne precaution, we must do hand hygiene, of course. Airborne N95 mask, So, common disease requiring airborne precaution are measles, tuberculosis, varicella. So, for droplet precaution, hand washing, surgical mask. So, common disease or droplet are influenza, pertussis mumps, rubella, meningococcal infection. So, droplet diseases spread when patient cough, sneeze, or talk. Mask and proximity control are key to preventing transmission. So for contact precaution stops the germs that cling to hands, clothing, and surfaces, making careful handling and cleaning essentials. It prevents transmission of pathogens like MRSA, VRE, and C. diff. So always do hand hygiene, gown, mask. The protective environment precaution are used to protect highly immunocompromised patients from infections rather than protecting others from patients. So let's move to prevention and management of needle stick and sharp injury. Please be smart with sharps. Do not recop needles. If recapping is necessary, use single hand technique or use mechanical device like forceps. Place the sharp on a solid tray and make sound or announcement every time it is passed. Do not bend the needle. Do not manipulate the cup needle. If needle should be removed from the syringe, always use forceps. Use forceps or tongs in picking sharps, debris, or any equivalent. So, for HIV/AIDS essential knowledge for nurses, preventing infection is key, but managing patients with infectious disease safely also requires awareness and knowledge. We will cover HIV/AIDS essential knowledge for nurses. What is HIV/AIDS? Human immunodeficiency virus attacks the CD4 and T cells, weakening the immune system. While AIDS acquired immune deficiency syndrome, it is an advanced stage with CD4 count less than 200 cells microliter or opportunistic infections. HIV leads to AIDS if untreated, not a death sentence with modern therapy. So, quick transmission routes, primary methods, body fluids, blood, semen, vaginal fluids, breast, milk. Common scenarios, unprotected sex, shared needles, mother-to-child transmission. So for mother-to-child transmission of HIV, it is during pregnancy, across placenta, at the time of labor and birth, through blood and secretions, through breastfeeding. It is not transmitted through casual contact, kissing, hugging, or sharing food, saliva, air, or insect. For nurses, always use standard precautions to protect yourselves and patients. So again, how HIV transmitted. So symptoms and stages. For acute HIV, flu-like symptoms like fever, rash, fatigue for 2 to 4 weeks post-exposure. For chronic HIV, often asymptomatic, virus replicates slowly. For AIDS, opportunistic infections like PCP, TB, cancer, wasting. So monitoring, regular CD4 and viral load tests. As you can see on the picture, before HIV infection, blood contains protective CD4 cells, the blue circles. No HIV particles are present, so the immune system is healthy. But weeks to monthly, the patient is infected. Acute HIV infection, after infection, HIV, you can see there is a red particles enter the body and attacks the CD4 cells. So the CD4 cells count drops rapidly as HIV multiplies. This stage may show like flu-like symptoms, like what I've said a while ago, and high viral load. For chronic HIV infection, Here, HIV continues to destroy CD4 cells but more slowly. The immune system weakens over time. There may be few or no symptoms, but HIV is active and can be transmitted. Here. Kumonti na yung CD4. Mas marami na yung HIV particles. You can see HIV particles dominate the blood. The immune system is severely compromised, making the person vulnerable to opportunistic infection. So, our hospital policy and guidelines for HIV testing, counseling first before signing informed consent, test request is VCT, voluntary counseling and testing. Pre-test counseling must be done by trained healthcare workers. Informed consent form is available at the blood bank. Confidentiality is required during counseling and testing. So results are released personally to the client or authorized representatives. Confirmed positive results are automatically reported to DOH. So post-test counseling and risk reduction advice must be provided. HIV results should be known only to the medical team and kept strictly confidential. No markers on the charts or rooms. Patients with STI, HIV, AIDS are not isolated, except in severe immunocompromised disseminated cases, standard precautions only. For testing, we have antibody antigen ELISA rapid test confirmed with Western blot or not. When to test high-risk exposure, routine screening in healthcare. Our nursing role, ensure confidentiality, provide pre- and post-test counseling, and link to care. For treatment and management, we have antiretroviral therapy, combine drugs to suppress the virus. We have the pre-exposure and post-exposure prophylaxis. It is a prevention tools for at-risk individuals. Nursing care, monitor adherence, manage side effects like GI issues, and offer support. ART reduces the viral load to undetectable levels, preventing transmission. There is a UU campaign, undetectable, untransmittable. Prevention strategies, best practices, using of condom, pre-exposure prophylaxis, needle exchange, safe sex education. Nurses, advocate for harm reduction, promote testing, use PPE. Pre-exposure prophylaxis reduces the infection risk by 99% when taken consistently, as per CDC. We can influence community health through education and policy advocacy. We're now moving to mother-to-child transmission of HIV, the role of breastfeeding. Benefits of breastfeeding for infants when mother is on ART. Breastfeeding provides infants of mothers on effective ART with key benefits like enhanced immunity, optimal nutrition, and reduced mortality from infection. Even the minimal HIV transmission risk is only less than 1% at 12 months with viral suppression. There is also nutritional and growth advantages, exclusive breastfeeding for 6 months, then complementary food to 12 to 24 months, supports superior growth, development, and reduced illness compared to formula in low-resource settings. ART adherence ensures low postnatal transmission with only 0.3 to 0.6% at 6 to 12 months, making benefits outweigh risks where replacement feeding is unsafe. Health protection benefits. It lowers the infant deaths from diarrhea, pneumonia, and malnutrition, protects against SIDS, necrotizing enterocolitis, sepsis, obesity, asthma, and diabetes. It also boosts immunity via antibodies and bonding. WHO endorses for art-adherent mothers globally. Mixed feeding avoided to maximize safety and gains. When deciding to stop breastfeeding, HIV-positive mothers should do so gradually within 1 month. Infant feeding recommendation for HIV-positive women. Mothers known to be HIV infected should be provided with lifelong ARV treatment or ARV prophylaxis to reduce HIV transmission through breastfeeding. ARV reduce the risk of HIV transmission in the first 6 months when infants breastfeed either EBF or mixed feeding, and after 6 months when infant continue to breastfeed while taking complementary feeds. ARVs are given either as lifelong treatment or as ARV prophylaxis for prevention during the period of breastfeeding only. When given as prophylaxis, ARV should be given until 1 week after all breastfeeding stops. The condition needed to safely formula feed. HIV-infected mothers should provide commercial infant formula as a replacement feed for HIV-negative or infant of unknown HIV status only when specific conditions are met. There is a safe water and sanitation available at home and in the community. The mother caregiver can consistently provide enough infant formula to normal growth and development. The mother caregiver can safely and properly prepare formula to reduce the risk of diarrhea and malnutrition. The mother and caregiver can also exclusively give infant formula for the first 6 months. The family supports the use of infant formula feeding. And lastly, the mother or caregiver has access to health care with comprehensive child health services. For our last slide, when the infant is HIV infected, if infant and young children are known to be HIV infected, mothers are strongly encouraged to exclusively breastfeed for the first 6 months of life and continue breastfeeding as per the recommendation for the general population that is up to 2 years or beyond. Thank you very much for listening. This is the end of our slide.